Okay, hello everybody. I'm just going to wait a couple minutes here to let all of our attendees log in. So bear with us. I'm going to do a couple shout outs. Hi, Brian Fitzgerald.
Hi, Brian.
Hi, Brian.
Thank you so much for joining us. All right, we're building up here. Fantastic.
Brian, were your ears burning? We were just talking about you.
Yeah. Sounds like you had
all good. All good.
Okay. Okay, so thank you all for coming. I know there's more people that are going to join us, but I at least want to get us started just to keep respect for everybody's time. So my name is Sarah Carpenito. I'm a sports injury prevention specialist at the McHaley Center for Sports Injury Prevention. I'm at the Waltham location, and ding, 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 we have a second location now. And that's it's in Norwood, and it is inside the Skating Club of Boston, which is kind of the motivation behind doing this webinar today, because we've, especially the McHaley Center and the Division of Sports Medicine at Boston Children's Hospital, feel we have a lot to offer that figure skating community, especially because we have people that are very specific to the figure skating world. So that being said, so we have Dr. Geminiani here with us tonight to talk kind of about the medical side of the movement of figure skating. And, you know, she's covered USA figure skating and worlds and all of those fun things. And so we're super stoked to have her side of things as well. And then we have Michael Cook, who's one of our sports injury prevention specialists over at the Norwood location, and he's worked with figure skaters for years and years and years. And he's got the inside scoop, literally inside the body scoop, about the figure skating movements. And then we also have Ariel Gagnon. And so hopefully I nailed that pronunciation, but
oh yes you did.
So also figure skating coach, and has worked with tons of figure skaters over the years. And so and she's a strength and conditioning specialist at our Norwood location for the McHaley Center. And then very shortly, Mirai, our US bronze medalist figure skater, is going to join us, and she's gonna kind of jump into our conversation, maybe answer a few questions and kind of touch on a few of the subjects that our panelists are gonna talk about today. And so as I know we're still building up on attendees here, so just a little bit of information. If you don't know what the McHaley Center is, obviously it's a sports injury prevention center, but we offer many services such as injury prevention evaluations, gait analysis, ACL prevention and return to play, concussion prevention and return to play. And we're also, because we're in this virtual world right now, we are offering virtual private training and virtual types of other virtual types of services as well. And as well as classes. So we're doing virtual classes, but also we could do in-person classes as well. So, and then the McHaley Center is part of the Division of Sports Medicine at Boston Children's Hospital. And that's why we have such a great relationship with all of our physicians in the department, such as Dr. Geminiani. All right, so let's have me stop talking and get to the experts. And so Dr.
Geminiani, try to share the screen here.
Yeah, Dr. Geminiani is going to give us a start, and whenever you're ready, go for it.
There we go. Oh my gosh, I did it, I think.
Yeah.
So I am from the non-techno age, or as Min Coker says, we're technology immigrants.
Yeah.
So proudly part of that group. Anyway, so tonight we're going to talk about the movement of figure skating. I'm going to start it off with more from the clinical side, because I'm a clinician, and then Mike and Ariel are going to help me out with the strength and conditioning piece and more of the true scientific biomechanics. but we've put it at a level where I can understand it, and hopefully then you guys, because it's a lot of physics. So we're going to try to, put this into day-to-day context on the ice. So here we go. So, I think we all watch sports, and we often say about the athletes, how in the world do they do that? And I think in many sports, there has been an extensive amount of research. There's a huge scientific body of evidence and information about the physics and the science behind athletic movement. Historically, figure skating, along with dance, gymnastics, has kind of been left out of that, considered more of a performing art. But fortunately, in my lifetime, that has changed tremendously. And if you look at some of the more recent publications that are starting to come out, my friend Lee Cabell with Erica Bateman put an article on biomechanics and figure skating in a monograph called Science of Figure Skating just a couple of years ago. And one of the first statements he makes is that the tenets of science, or the concepts of science, have been identified and integrated into figure skating. And I think that's great news for all of us, because it needs to be, and we need to catch up with where other sports are. They go on to say that, the integration of neurological along with the musculoskeletal system is responsible for all movement. So I think that's an important concept to think of. I don't think you have to understand all the nitty-gritty details, but we have a skeleton of 206 bones, and that's connected by ligaments, and it's in a lovely arabesque position on the right, but without the muscles, it would be a pile. And so there are 850 muscles in the body that are stimulated by the nervous system to provide function and in turn create movement. So gaining an understanding of this scientifically, even in an art form, I think is hugely beneficial. Or a sport that has a tremendous artistic component, I guess I should say. So when we talk about movement, there are several planes of motion that the body can move into. And there are three of them. So sagittal plane, frontal plane, and transverse plane. And this is more of a geometric concept, but geometry fits into physics. So when you look at the sagittal plane, and that's the rectangle that sort of divides the body in half. So you think of movements that could go along that plane, if we were up against that wall, then how could we move? And similarly with the frontal plane, how could we move without crossing that plane? And also cutting the body in half, the transverse plane. So let's look at each of those. Oh, hi, Mirai is here. Welcome, Mirai.
Hi, thanks for having me. I'm in a little bit of the ice rink, so it might be a little loud, but I'll try to help as much as possible.
Yeah, well, we're probably just going to ask you some questions and stuff, so, or chime in whenever you have something comes to mind, please. So when we look at the sagittal plane, it divides the body into right and left parts, and sagittal movements can be flexion or bending, and extension or straightening. And you can move your arm in a flexion extension, you can move your leg in a flexion extension, the head can move flexion extension, the torso, the ankle. So there's many movements that can happen at different joints that still operate in that sagittal plane. And the pictures demonstrate the young lady in the layback. It would be an extension of the torso to get that layback position. And also the spiral would be an extension of the hip as well as a flexion of the torso. There's a little bit of rotation in that as well, but you can move into more than one. You can't just stay in one plane at a time. But understanding how these operate and then how they interact is important as we look at the concepts around biomechanics. So in the frontal plane, we can move our head from side to side. We can move our, bend at the waist from side to side. We can move the leg or arm out away from the body, which is called abduction, from the Latin of to take away. Or we can move towards the body or the center of the body, termed adduction, which means return to myself. From the Latin. So that's how those words came. It's just fancy terms for moving in and moving out. When we look at the young man landing the jump, his arms are in the abducted position as the leg of the girl doing the sideways layback. She's tilted to the side in the frontal plane, and her leg is extended horizontally. And then we look at the transverse plane, which basically bisects the body in half. So it would be, rotating at your waist, rotating your arms, rotating your hips in and out, and head side to side instead of flexing side to side. So this can create a whole host of changes and different positions that create the beauty of our sport, really. So figure skating movement encompasses movement through these three planes, but there's also a type of motion or different types of motion that can occur. We have linear motion, which is basically distance moved across the ice. And speed or velocity is termed or defined as the rate of movement. You can change the rate of the velocity or the speed by accelerating or increasing, or decelerating or decreasing. You can also rotate in an angular motion, rotate the body around itself or a body segment or from one plane to the other. And our friend Mirai is going to demonstrate some of the concepts. There it goes. So you can see that she has, I got to turn this down a little bit, that she has movement in a linear direction. She's also doing rotational movement, angular movement, and rotating. And you can see body parts are moving into different planes in a fairly quick sequence in a lot of situations. And then when you put it all together into a step sequence, it's even faster and more complex, which is part of the challenge of even just basic skating, right? So when we talk about the third type of motion is called projectile motion. Basically, your body is launched either under your own power or that of your pair partner into a jump or a projectile motion, something being thrown. So you're either throwing yourself or you're being thrown or helped with that. So figure skating, of course, is very complex. And I think ice dance is one of the top the disciplines that really demonstrates that significantly. And you can watch Madison Chalk, Evan Bates, who just do amazing, intricate movements and stay on balance and very quickly in sequence and movements at the same time through all the different planes. So it can become quite complex and intricate, which is kind of the point and the goal that we set for ourselves as skaters, right? Okay, so we turn to the laws of physics to help us, and don't gloss over because I mentioned physics. It's okay, we'll get through it. So when we look at the laws of motion in physics, it helps us analyze the movement of the body as it relates to the forces that cause movement. And to oversimplify what figure skating is, a physicist once tried to teach himself to skate, and he came up with this statement. He said, executing a movement while maintaining control of the body as it responds to forces acting on it. And he found it to be way more difficult than he anticipated. So I think that speaks to the challenges that we have. So if something is pushing or pulling, there's an internal force such as a muscle contraction, or an external force, gravity, always present, can have an influence on skating movement. And sports medicine science, part of our task we're charged with is to interpret those forces and energy that affects body movement, and ideally to understand it to the point that we can prevent injury and then also improve performance of skills to make things as efficient biomechanically as possible, at the same time usually preventing injury. So if we take just the very basic forward outside edge, you stand on the ice and you push off, you apply a force to the body, creating acceleration in a linear forward movement. And due to Le Chatelier's principle, I didn't even put this up here, but we know the pressure of the blade on the ice creates a film of water that we can glide on. And without any other forces affecting us, we could keep going for almost infinity, but there's friction force that increases as edges are deepened, change direction, moving on the blade, etc. So one of the goals that we have using biomechanics to understand is how do we minimize that friction so we can maintain the motion forward and in turn the speed, which is of course always graded higher, right? We want to be faster. So the key to this proper positioning is alignment. And if anybody's ever taken dance classes, you probably have been told about your placement, which is the equivalent measure. And basically you imagine a line that goes from the very top of your head straight down through the center of your body, down through your ankle. And that's the axis of the center of forces where that should rotate around for each individual body. Correct alignment makes for efficient motion. And if we look at the hip and spine, which move together frequently, especially related to skating, so I think this is a good example. If you can find that sweet spot on the blade when you're properly aligned, I think you all know what I'm talking about, right? You feel solid, you know where you are, and you feel like you can hold the position. That's because you're aligned correctly and the muscles are stabilizing you there. Also notice, it's not well illustrated here. There's a slide that shows it better. There's curves that normally occur in the spine. There's an arched curve in the neck, then there's a more concave, a convex curve in the thoracic spine, and then the lower back has another convex curve. And those are deliberately designed to absorb forces of the distribution of weight through the spine, especially with jumping, landing, etc. So in order for that to work properly, the spine has to stay lined up correctly. And it can be a complicated response sometimes to the forces and any patterns of imbalance. And especially in folks that have what we call hypermobile joints, where those ligaments that connect and hold joints together are a little looser in some of us than others. And so we're able to move that joint more readily, and it may not be as helpful. I mean, you can maybe get to a position, but it can cause some complications, but that's a whole separate talk right there. So what's supposed to happen is we should be able to get aligned correctly. And in order to do that, you have to have proper flexibility. And if we're going to continue to pick on the pelvis and spine, one of the major factors in this, or culprits, is the hip flexor muscle, or the anatomic term is iliopsoas. And I don't think I have a pointer. Can you see the arrow? No. So if we look at along the spine there's the muscle.
Yeah, we can see the arrow, Dr.
Oh, we can see the arrow, thank you. So this is the iliacus, okay? So I'm sorry, this is the psoas, connects from the spine, and then the iliacus comes along the crest of your hip bone. The two large muscles join together right here across the hip and is one of the major factors in hip flexion. But you can easily see from these other depictions that if it's shortened, it's going to pull that pelvis forward and then increase the curvature of the spine, which then completely disrupts the ability of the spine to dissipate those forces with landings. And then this area here where the red circle is, these elements of the spine are kind of crushed and compressed, and they can take a lot of stress. And that's where we end up with a lot of stress fractures in the back. So the point is, what's supposed to happen is that all these muscles should be flexible enough so that we can get correctly aligned. And then we have to maintain the strength in order to, or have the strength to maintain that position through whatever movement, extending the free leg, a body rotation, change of edges, feet, direction, as Mirai demonstrated in her step sequence. So we want the hip flexors to be strong, but we don't want them to overwork, or as in many individuals, many athletes, they're on all the time, and they have to know their role and when to fire and contract, and it has to work in concert with everything else. So that's one of the challenges. This is, I am dating myself, Dorothy Hamill, probably one of the most beautifully aligned skaters, in my opinion. She just had beautiful, beautiful posture. And when we talk about alignment and from a biomechanics perspective, we're talking about the center of mass. And so the center of mass is pretty much in the center of where everything is balancing in your body. And then the force of your body weight pushing down, pushing down is a force working against. And then there's also a ground reaction force, because what you push down on the ice pushes back up with you, one of Newton's laws, right? So the goal is to achieve this aligned position. And you can see how nicely she's able to maintain that position. And we'll talk about how that happens. So an example of stabilizing the pelvis with the weight on one leg, as Dorothy was demonstrating. The hip abductors, which are basically your glute medius and a few other muscles, will stabilize that standing leg. The unsupported side uses some of your back muscles, your quadratus and your internal obliques. So there has to be muscle firing here for stability. The inside thigh muscles have to work in the free leg so that it doesn't fall down due to gravity. And then you get your nice position, but those muscles have to fire at the right time and be strong enough to maintain the position through the movement. And as you might imagine, this can go wrong a lot. The hips and pelvis are connected and they work together, or they work with each other. So what happens to one affects the other. So if the spine is incorrectly aligned, in that you have a very swayed back, the hip and pelvis is going to compensate. If the pelvis is incorrectly positioned, the spine will compensate. And compensation is not a good thing. It sounds like a good thing, and for a once or twice kind of situation, it would be okay. But in an ongoing basis, it can lead to overuse and difficulties with injury. So alignment is a skater's lifelong goal. Kurt Browning is brilliant at it. And it doesn't happen overnight. And you can see in the skaters above, you know, they're leaned forward, trying to find that center of mass and balance it. And it's an evolution over the course of your skating career to be able to move to the upright position. So it's part of the skill training that happens. One more concept I just want to introduce before Ariel is called the moment of inertia. And so when that plumb line, or that center of gravity or center of mass, is really your axis of rotation when you step into the rotational component of things. And so if you have body parts like your arms out wide, that makes the moment of inertia greater and slows down your rotation. So we all know we need to be tight. And I think this illustrates that nicely. The young lady on the left has some elbows out and legs aren't quite tight, whereas Gracie demonstrates a very nice tight air position. So that's, you know, the goal we're looking for. Mirai, I'm wondering, were any of these things kind of brought up to you as you were learning? I mean, this was stuff that was introduced to me, you know, from my coaches, but that was a lifetime ago. And just wondering what the current situation is, if you had experienced any of this or were taught any of this.
Ellen, the young lady on the left is me, and it was definitely not one of my best performances. I was on national television, and if you look at my knee, it's like really blocked because I actually like tripped in that performance and fell into the wall. And then I think that was a double toe. I didn't do any triples because I fell really hard on my knee, and I had to leave for Junior Worlds the next week, and it was not my best moment, but you can see that on doubles, I'm able to get away with a much looser position. But as I was growing up, it was drilled into me that I always needed to be over my right side in the air strong, and especially on jumps like triple toes, you want to be over your right side and then transfer your weight quickly and then get back over the right side. And I had a coach who was very, very focused on my hips, like where my hips were located. And I think that's something that I try to really focus on as I teach my own students.
Great, thanks. Sorry, I didn't mean to pick on you with the picture.
No, that's a bad rotating position, and I'm glad that you used it. The one
We all
of
have our
Gracie
moments,
is
honey.
much better.
All right, so Ariel Gagnon is going to talk to us about spins and jumps, and I'm sure she will pick on Mirai a little bit about her experiences and information. So I am going to stop my share, right?
All right.
And then Ariel is going to start hers.
Ariel, just 1 second. So just an announcement to all the attendees. So I put this in the chat as well, but feel free to ask questions in the chat or in the Q&A tab. At the end, we'll be able to shoot some questions at everybody in the panel. Okay, so don't be afraid. Shoot some questions there and we will address them later. All right, thanks. All yours, Ariel.
Perfect. All right. So, so I'm going to start with spins. Can everyone see this? Making sure I'm doing it properly. Are you guys able to see my screen?
Yes.
Perfect.
Yes,
Okay.
we can see.
Just want to make sure. So for the sit spin now, the sit spin, we have 4 parts to it. We have the preparation, we have the entry, we have the spin and the exit. Now, when I'm talking about the sit spin here, I'm talking about that forward sit spin. And as you can tell here in the picture, you can visually see what the spin looks like on the ice surface. Now, in this particular example, the skater is entering the spin from a backward crossover. And during this preparation phase, they are going from a backward inside edge to a forward outside edge on the other leg. Now, this allows the skater to decrease the radius of their curve and in turn also reduce their speed and velocity. Now, it may seem counterintuitive to slow yourself down before entry, but in fact, this is going to allow us to better move around our axis of rotation. Now, the forward outside edge step will then increase their force against the ice as well as create an angular momentum needed during their spin. Now, this is an important fact to consider because without this initial push, the spin will be lacking the torque and angular momentum needed to spin faster and for longer. So another detail worth mentioning is how the skater starts to rise up at about 3/4 of the way. So you'll notice about right here, right before they enter the spin, they're going to rise up before they snap into that spin and get the speed that they need. Many skaters tend to rush this part and are unable to save the spin from collapsing. And this is due to the fact that without proper depth and duration of the entry, the skater will have a hard time getting on the right side of the blade, centering their spin and keeping their speed throughout. So once the spin is done, the exit is on a backward outside edge on the opposite leg. I would actually love to get Mirai's input on the sit spin before I continue, kind of getting her input on the phase of the spin and what she emphasizes with her skaters.
I think with all spins, the rocker is the most important part about, especially for young kids, figuring out where the rocker is, because once they learn where that spin point and axis is, it translates to all of their other spins. And so I think it makes sense that we start with the scratch spin and then we move on to like a single leg squat essentially. And the momentum definitely helps, but I think that, yeah, like once you hit that moment of that, it's hard to explain in words, but it's almost like you're doing a 3-turn, but you kind of catch that feeling of your rocker and then you stick to your rocker. And then it's kind of about figuring out which moment you use to garner more speed.
Yeah, exactly. I mean, especially with the sit spin position is definitely a spin that, is a complicated one too, because of the fact that the position is, we have our leg out. We're not actually closing our legs in like a scratch bin. But as Dr. Geminiani previously mentioned when she was talking about, moments of inertia, the mass of the skater as well as the weight her weight is distributed within the axis of rotation will have a big influence on the resistance to the angular acceleration. So like simply put, when you spin faster with your arms and legs closer to you, and the opposite applies when they're further away. And not only that, but a skater has to also fight against the laws of inertia that are trying to pull their arms and free leg away from them during their spin. So I'm going to go to the next slide. So basically, to sum up a few points here, it takes one rotation to execute the sit spin position, and to do so, the arms and free leg move around the supporting leg to create a greater moment of inertia. Now, if we take longer than that to get into our sit spin position, we won't be able to properly and efficiently execute the spin. So that's why it's really important during that one rotation going into the spin that we do get that sit spin position in there within that one rotation, that we don't take much longer than that. Another point, when we're talking about the next step after the entry, this is when the skater reaches the largest angular velocity of their spin. Now, why is that important? Well, if we don't take enough time, if we don't have enough time going into that entry of our spin, we are not fixing the root of the problem, and ultimately we are not going to have a fast and consistent spin. So again, if we're not getting a strong and clean position, it's going to be really hard for that skater to ever really have an optimal sit spin position and sit spin speed. Another point, when talking about the sit spin position, especially when our skater is learning and perfecting the basic sit spin, we need to make sure that the heaviest part of the body is closest to their center of gravity. And this is important because their moment of inertia is greater and therefore slows them down. So the free leg and hips need to be parallel to the ice. Now we're going to go over these two pictures here. We have a good sit spin and a bad sit spin. So on the left, the skater's hips and free leg are parallel to the ice. The arms are close together and they're extended forward, and she's completely centered. So you can see really where that center is here. You can see definitely we're creating a good position, and she's on that rocker that Mirai was talking about. Now on this bad sit spin position here, you can see that the person is essentially, the skater's hips are below parallel. She's creating further distance from her center of mass. And she also appears to be using her arms to anchor herself up rather than using them to control the spin. So again, to kind of finalize that on the sit spin position, it's really important to have a strong sit spin position. And to attain this position as well, it's going to take a lot of strength training, which again, Mike will be able to bring up later on during this presentation. Next, because things aren't complicated enough, we're going to now go into the Walsh jump and the axel jump. Now, for any non-figure skaters that are tuning in, these jumps are the same with the exception that the axel is an extra turn in the air. So a Walsh jump is half a turn and an axel is a turn and a half. The axel and Walsh jump are also the jump that does start forward and lands backwards. So we have 8 parts in this jump. We have the setup, the load, transition, pivot, takeoff, flight, landing, and exit. In this picture, you can see that some of the key parts of the jump, where we have that highlight of the takeoff angle, we have the hip flexion during the takeoff, and the body tilt during the rotation, just to name a few. So those are a few things that we do need to focus on when we're talking about the axel and Walsh jump. Before I get into details of each part, I do want to point out the importance of the takeoff and the entry of this jump. Now, it is during this part that the external forces of the skater's jump initiate the rotation, the lift, and the angular momentum of the jump. So it's safe to say that the proper pattern and entry of this jump is crucial to the quality and the performance of it. So first we have the setup. So we have our skater is on a backward outside edge and the free leg is behind her. Now notice the shoulders being down and the arms pulled somewhat back. Now this is going to help the skater stay on a stronger outside edge. The head position with her looking over her left shoulder helps keep the skater's mass properly distributed while also allowing the skater to look where she is going and where she wants to step. I also have a picture here kind of showing what it looks like before that person then goes into the next part, which is the load. So the skater keeps that left shoulder leading while putting her body weight onto that forward outside edge. Now, from this initial step, we have the transition. Now, the transition is quite quick, half a second to be exact, and necessitates a great flexion of the knee, hip, and ankle of the supporting leg. So as you can see in this picture, knee, ankle, and hip are greatly flexed. Also, in this moment, the energy potential is decreased, and that allows for the next step being the pivot. Now, the pivot is an interesting one to explain. Notice here how the skater is leaning slightly backwards and creating a kind of hook with her blade. This is going to allow the skater to transfer her energy efficiently during the next part, which is the takeoff. Before I go into the takeoff, I actually would like to get Mirai's explanation of what she feels like the pivot entails. So that's definitely something that she knows a lot about. She landed the first triple axel ever in the Olympics, so I would love to get her input on this portion.
Yes, I think that with the axle, because it's a forward takeoff jump, it's a little bit like jumping off a cliff, and you kind of have to really trust that edge. And I think there are two types of axle jumpers. There's the type who skid on the takeoff, and the type who are clean edgers, like Scott Hamilton and myself. And I think that there's a moment in the axle where you feel like you're checking and your time kind of stops, and it's in that moment where you're able to climb up into the air, and that's where you take your blade anatomy and like you really push through every part of, well, except the heel. You push through your rocker, and then you push through your toe pick, and when it feels great, it's delightful. It's like buttery and fun and yummy. And when it's bad, when you just like can't get that click into the air, it's very, very rough. And I find that, I mean, I'm obviously biased because I'm a clean edger, but with these skidders, they do have an easier time climbing up into the air because they have that click through better, whereas like I'm really playing it till the very end to like get up onto my toe pick, and it's more of a trust process. However, with skidders, you really have to learn how to, you know, basically stop before your axle. And so there are different types of axles. It's not like one is better than the other, but it all depends on getting up through the toe pick, and that's how I feel like between triple and double, with double I could have a really bad takeoff and still get it done just because I had done it for so many more years, whereas with the triple, my pivot, as you're calling it, had to be really good.
Yeah. And I find that's a really great analogy, talking about, like it says, if you're jumping off a cliff. I find it's a really good way to describe it. And also, you know, talking about how that skid, the people that do skid tend to have a bit of an easier time. It also kind of shows that they have more time to reduce their horizontal velocity, which again ends up kind of benefiting them. Whereas for you again have to be very clean and very precise with your timing. So it's definitely a good point to make that, you know, it's not that one's better than the other, but there is definitely some pros and cons with both of those. Moving on to then the takeoff. The takeoff allows the skater to get that triple extension from the hip, knee, and ankle that we were just flexing, which in turn is going to allow us to get more vertical velocity. So as you can see in this picture here, you have that triple extension before going up in the air. During the flight now, so the next picture here, you can see here that the skater has about a 10 to 15% tilt of the body, which becomes quite advantageous during the landing. And that's because it's going to help them absorb the forces from the landing, as well as better handle the friction between the blade and the ice during such. And then to finish off quickly before I send Mike your way, the landing, as you can see in this picture here, we have the hip, knee, and ankle flex once again, and kind of creating that eagle pose. So for anyone who's a yoga enthusiast, that eagle pose, you have that, so the free leg, the knee is slightly out, so the hip is slightly externally rotated. And for a skater, that's going to be beneficial if they have a combination jump to do after, allowing their free leg to come around and get momentum for the next jump. It's also going to help them absorb the landing and get a nicer glide on the exit. So that's all for me. I'm going to unshare my screen. Where Where is the button? I think did I unshare it?
You have unshared it.
Perfect. Okay. I was
All
like,
right.
sure. Now, Mike, it's your turn.
I'm so excited to be speaking to everybody here from the actual McKaylee Center in Norwood at the Skating Club of Boston. We are located at 7050 University Ave, and please feel free to come down and visit us, whether it's to see us for our services or to spend time at the brand new Skating Club of Boston facility. All right, let me pull up my screen here so I can get things up and running. This might take a moment. I'm not as technologically savvy as a lot of people are.
No worries, Mike. Just so you guys know, we have some great questions coming in. So I'm super excited about our Q&A sesh. But if you attendees out there, more than welcome to continue sending in your questions and they will be addressed later. Thank you.
All right, there we go. So we talked a lot about the physics of figure skating. I'm going to get more into the foundational part to try to establish just some mindset about what is it that can impact those physics. And first, as you can see on my first screen, we're going to talk about the muscle movements. There are different varieties of muscle movements. Some of them you actually move, some of them don't move. Some of them it's just a feeling of the pressure of the movement itself. And as you can see, isometric contraction is the first one. The muscle doesn't shorten, but it takes the load. So it actually helps to build up that strength at a consistent level of just draw onto from the anchor to the attachment. The second is a concentric contraction. What we're doing is that they're demonstrating in these photos is that the bicep is flexing. It's shortening the muscles on the front part of the arm so that it flexes at that elbow and brings that weight closer to the shoulder. So concentric contraction is just a shortening of the muscle belly itself, bringing two distant parts together. And the third one is eccentric contraction. So now the weight is loaded and it's returning back to its extended state. And the muscle belly, in this instance, the bicep, is allowing the muscles to go down under a controlled motion. It's important to train all aspects of these contractions for the body to be able to support itself. Strength is a foundation of your ability as an athlete. The greater your strength is in managing the forces that are impacted on you, whether you're participating in figure skating or any other sport, the stronger you need to be able to support yourself while you're doing that. And then we just want to be able to help to reduce that injury exposure. And if you're strong, we're reducing that injury exposure by increasing the strength of your movement capacity. Next, we're going to look at the muscle rolls. As you can see in the photo, what are the roles of skeletal muscle during movement? When completing movements such as walking or squatting, there's a lot of different muscles involved in order to complete the movement smoothly and effectively. They achieve this as they each adapt to different types of contraction, as we spoke about a few moments ago, concentric, eccentric, or isometric, and they have their own specific role to play during that movement. There are 4 specific roles that the muscle can fulfill during movement. The roles are agonist. Agonist is a movement in the muscle that provides a major force to complete the movement itself. Again, going back to the bicep, the agonist is known as the prime mover. So the bicep curl produces flexion at the elbow. The bicep muscle is the agonist as seen in this photo or in this depiction. The agonist is not always the muscle that's shortening or contracting concentrically. In a bicep curl, the bicep is the agonist on the way up when it contracts concentrically. On the way down, it's contracting eccentrically, and that's because it's the prime mover in both cases. So looking at elbow flexion and extension. The next role is the antagonist. The antagonist in a movement refers to the muscle that opposes the agonist. So in this instance, we're thinking of the tricep muscle on the back as the antagonist. So when the bicep is contracting and shortening, the antagonist is lengthening. And then reverse, the bicep is accepting that load on the way down, but the tricep really isn't doing the opposite action. It's just relaxed, controlled. If you put a resistance on the opposite side, then you're going to get that eccentric load onto the load back onto the tricep to get that to go into extension. The third is the synergist. The synergist is a movement in the muscle that stabilizes the joint around which the movement is occurring, which in turn helps the agonist function effectively. Synergistic muscles help to create the movement. The bicep curl, the muscle synergist, is the brachioradialis and the brachialis, which assists the bicep to create the movement and stabilize the elbow joint. As you can see, they're located in this area. Okay, and then lastly, we're going to talk about the fixator. The fixator is a movement of the muscle that stabilizes the origin of the agonist and the joint that the origin spans or it moves over in order to help the agonist function most effectively. In the bicep curls, this would be the rotator cuff muscles. So there's 4 muscle structures inside your shoulder that help to stabilize the joint, to keep it properly located and seated into the glenohumeral joint to make sure it's stable enough to perform whatever the motion is, whether it's flexion, whether it's abduction, or whether it's going into extension. Next, we're going to go to a physical therapist by the name of Gray Cook and analyzed the joint kinematics of the body and postulated a diagram that reflects how the body provides support for movement. And as you look at it, it reads stability or mobility. The ankle joint, you need mobility, you need lots of range of motion, mostly in the sagittal plane. The knee joint, you need to have stability. The hip is multiplanar mobility. It's all about movement. The lumbar spine is about stability, trying to support what's going on with the hip and transferring forces. The thoracic spine is about mobility. The scapular is about stability, and the glenohumeral joint is about mobility. So the scapular is resting on the rib cage, and it provides stability so that the glenohumeral joint can have mobility to it. If you think about what's going on, we're basically a stacked system of mobility, stability, mobility, stability, mobility. When one of those aspects is defective or dysfunctional, we'll use the ankle, for example, because there is a pretty high incidence of injury in this sport in the ankle. When that mobility is compromised, that means that mobility has to occur somewhere else. And if it can't occur at the knee, because the knee's supposed to be stable, where is it going to go to? Well, that extra force is going to go up into the hip, and then it will lead up into the lumbar spine. And the way I look at the lumbar spine is the hip is the gateway to the lumbar spine. So if you look at the Lumbo-Pelvic Hip Complex, sorry, just changing slides. The hip is, the forces that interact or that affect the hip and the ability for the hip to move. So if you look on the green circle on the left here, you're going to see that the interaction of the joint for the pelvis and the femur affects what goes on at the pelvis. From the pelvis, it goes up to the spine. So if something is dysfunctional here at this joint level or below, that reflects to dysfunction going on into the pelvis. That pelvic dysfunction loads up and changes the way the forces are dispersed into the spine and typically will load directly into that spine. So the pelvis and the lower body are integral in trying to deflect any additional stress that can go into the spine and properly managing how things feel and decreasing that risk to injury. So I'm going to talk a little bit about the core now. Okay, the core is just defined as all the muscle structures that are from your pelvis, outside of your hips, coming up through your groin, through your abdominal complex, attaching at the base of your ribs, from the front to the sides and the back. They provide multidirectional stability to the middle of the body. They transmit and absorb force. They create and resist rotational forces, and it can influence respiration and pelvic control. It's a lot of responsibility to the middle of your body, but does it always mean that it has to look like that six-pack ab? Usually it just needs to be functional. We need it to be strong and supportive so that it helps to decrease those forces that are interacting, that are affecting your pelvis and riding up that chain into your back. Next, we're going to move down the chain a little bit and speak to the glutes. The glutes are a powerful mover of the leg. Glute maximus tends to extend the hip and externally rotate the femur. Glute medius and minimus abduct and elevate the femur into the joint. Both of them assist in keeping the integrity of the humerus into the joint itself. That can work as a plus and a minus. If your hips are restricted and you can't perform external rotation due to a limitation, whether it's a bony limitation or it's that would be a structural limitation, or it's a functional limitation because the muscle structures are short, as Dr. Geminiani alluded to earlier. If they're short and tight, it limits the ability for the joint to move properly that's affected by those muscle structures. If they're long and strong, the joint moves happy, it decreases the chance and risk of injury and specific trauma into that area. And then we're going to move down to the hamstrings. And I find that the back of the leg is an integral part of how our body functions. The hamstrings have a lot of responsibility. They attach to that pelvis. They attach below your knee. You want to make sure that, again, that they're long and strong. When they're short and restricted, it pulls directly on that pelvis and increases the chance that your pelvis is going to go in an anterior rotation, or posterior rotation, and it's going to cause dysfunction at that hip, limit the ability for the pelvis to move forward and backwards. So where does that movement of forward and backwards go to? It travels right up into that lumbar spine. And there we go, and compromising that lumbar spine again. So again, it's important to understand the way each one of these muscle groups stack on top of each other, each one of their joints function, and how they impact it. Another thing that another aspect of the hamstring function is that it flexes the knee. As we know, you bend your knee, you straighten your leg. Your quads are the agonist when you straighten your legs. Your hamstrings are the agonist as you're flexing the knee. The hamstrings also control the attitude of the tibia. And what I mean by that is that if you contract the lateral aspect of your hamstring, it's going to produce external rotation on the tibia. So your tibia rotates around based on the contraction of the muscle structures of your hamstrings. So they attach behind, and your tibia either pulls laterally or it pulls medially based on the tension that you're carrying. If you have an imbalance, feel like your hamstrings are really tight. Are they really tight? They need to be measured and evaluated to determine if they're really tight. Because if that's the dysfunction because of tension, we can impact that. But is it really that, or is there a mobility issue? Is there mobility at the ankle that's not allowing your fibula to your tibia to rotate? Is that mobility hampered by the tension more on the medial or lateral aspect of your hamstrings? And then how does that tension transfer itself up into the base of the pelvis? And then we're going to strength training. So strength training, why do you train? What's the purpose behind it? Well, I mean, ideally to promote resistance to injury, because without resistance to injury, we're not able to enjoy the sport that we love to participate in. If it's figure skating, if it's bowling, if it's archery, your strength training makes you bulletproof with regards to some types of injury. It also improves your overall athletic performance and your athletic ability. I think of it as athletic education. The more athletic education we can give you, the stronger you become, the more bulletproof you're going to be, and the longer you're going to be able to enjoy the length and the time that you want to spend in your sport, or you change sports. And then lastly, how do you train? Where is your focus? Do you do just general prep all the time? And general prep is great. There is definitely a position for it, but eventually you need to be specific with some of the demands that are placed on you to kind of emulate the things that are occurring on the ice. So if your general prep is strength training, mobility and flexibility, speed training, power training, aerobic training, and anaerobic training, then we move to the specific aspects of it of landing and jumping, mobility, flexibility. Again, look at abioment. It's about mobility and flexibility. They work with each other to help to improve your ability and decrease that risk to injury, but learning how to do it properly. And then anaerobic training, program run-throughs. Everybody loves those. Gas them out until they can't move. Just kidding. No. Repeat. It's about performance and improving your capacity to be able to perform on the ice. Off-ice training creates a foundation. Think of it as a pyramid. We're creating foundation at the bottom. We're building up on that pyramid. The more things we can stack on top for you to manage appropriately, the more successful your pyramid is going to be. Eventually, you're going to be at the peak, which will be at the Olympics. Right, Mirai? All right, I'm going to turn it back to Sarah, and we will go from there.
All right, thank you.
I'm trying to
That was more my language, Mike.
Oh,
So.
Thank you, I tried.
So I just have to say, this was fantastic because I'm watching some of the videos and the pictures that you guys are putting up there, and I'm thinking about the young skaters that we see all the time. And I just want you guys, if there's any young, figure skaters watching this right now, I want you to know like how incredible what you're doing really is. Like, I did not grow up figure skating. I grew up, I played softball and field hockey and all that stuff. I was a field sport athlete. And so to see what you can do on the ice, it truly, truly is such a complex movement. And it really is just so amazing. And so just a little pat on your back there, because what you do is really difficult. So I just had to put in my 2 cents there. So just so whoever wants to jump in on these answers, let me know. We're going to try and go as quick as we can because we're running out of time, but we had some great questions here. So a couple questions that are kind of related. It says, as skaters grow and go through puberty, their body alignment is likely to change. How do you help athletes stay injury-free during this phase as they're trying to regain their sense of alignment through their jumps? How do you help them regain that sense of alignment?
I'll jump in there. That is an excellent question, and an incredible challenge. You have to bear in mind, and I remind everybody about this, that bones grow first. So say a skater goes through a 3-inch growth spurt, the bones grew 3 inches, but every other muscle, tendon, and everything else grew about 1 inch.
Mm-hmm.
So just by the growth, you're at a huge disadvantage. This is not the time to be pushing them to the next level of skill or, learning more advanced things. This is the time to back off a little bit, not, stop altogether, and focus on realigning with good stretching and flexibility, and then re-strengthening. Because even though if they had been strong before, there's a certain amount they're going to lose as they grow, and it's a new product that you're working with. Mirai, I know you had as from your growth spurt, I remember historically, again, I've been around this a long time, it was a big struggle for you, I remember, going through that growth spurt. Do you want to comment on how you were guided through that, or if you were guided through that?
I mean, I think that I definitely struggled through it, and I would definitely say that as I transition into my own coaching career, there are many things that I struggled with that I hope to help my own athletes differently. And I think that was definitely one of them, is that I mean, I'm a repetition skater, and so I would just keep doing things over and over again. And I've been really trained to stay on my feet and land jumps regardless of how cheated things were. I still believe that does definitely help figure the timing of jumps out. However, I think that instead of throwing myself into jumps over and over again, which does tend to lead to injury, I would want to be monitored a little bit more carefully, just so that I'm not overusing so many of my bones, I guess, and my muscles, because I think that, as an athlete, it was always like no pain, no gain. And so it was easy for me to just keep going through any type of pain. So I guess that's why I would want my athletes to work more closely with a medical team to help monitor the differences between the good pain, which is from being sore and gaining new muscle, as opposed to just practicing through all types of pain.
Well, I think also if you're looking at a growth-related injury and going with that perspective that they go through, say we use that example that Dr. Geminiani said of that athlete going through that 3-inch growth spurt. Yeah, the muscles, tendons, they're going to have greater tension on them. And that tension increases specifically at the joint. And if you think about it, if you've got a hamstring that's really tight because you've grown just 3 inches on each leg, that's a lot of growth, but 3 inches on each leg, hopefully it's symmetrical. That means that that knee joint is going to have lots of tension in it. It's tension from the down muscles pulling down. It's tension from the up muscles pulling up. So it's kind of sandwiching that joint in together. We want to try to teach them how to manage that distress, give them the tools to be able to decrease that load into the joint. And that's where you lose, that's where you get some of that dysfunction to occur with the athlete, is that they don't gain that perspective. They don't gain that ability to appreciate the tension and trying to relieve it, so that improves their ability to decrease that risk or decrease that increased risk to injury while you're going through a growth phase.
I think a good recommendation, sort of just in general, would be, get a good physical therapist to work with the skater, and they can identify where the asymmetries are that have developed from the growth, and then guide them into proper stretching where the strengthening needs to happen. You can, sign up for classes at a McKaylee Center, or, numerous other programs that are out there that you may have access to. But I think thoughtful observation of their movement, and you probably notice that they do things differently. Yes, they are, because their body structure is different. So it may require some adjustment of technique.
Well, one thing too I'd like to mention as well, especially speaking from like someone who's also a figure skater and someone who also went through puberty as well, with women, we tend to get developed obviously at our chest and our hip area. And I find that one thing that I definitely struggled with was obviously the weight distribution, and how, you start to feel like you're falling far more forward. I find that that's something that, strength training and doing things that allow you to have better body awareness and having more strength within your core, within your center of mass, I think can really help some of these kids go through that puberty without feeling like it's affecting them so much on the ice. It just kind of helps them catch up to it a little bit. Because I find that's something that even right now, I see a lot of my skaters go through, and that they have a hard time, and I have to remind them that this is a normal thing, and that we just need to take that one step back, take 2 steps forward. So I find that's also something to take into consideration.
And that's just a side comment for all athletes, really. What we see a lot at the McKaylee Center is that while repetition is necessary for skill development, if the foundation isn't there, then we need the foundation, right? And so the foundation does come from everything that you guys just explained, like strength training, but especially during those growing years, those growing phases, it's more about control. It's about being aware of what your body does, how it does it. How do I know I'm using my core when, I go up into the jump? How do I know I'm using my glutes? And that's kind of what we teach at the McKaylee Center too. And so, like, all of those things have to be addressed. And then maybe you don't have to do repetitions, like 100 of your jumps to perfect it. You can actually just do 10 and be all right.
Well, it becomes like a quality over quantity type of thing as well, right? And it's like, again, I catch kids at the gym sometimes when we're doing exercises, and they're like, is this the muscle that I use when I'm going into my axle? And I'm like, yes, that's actually, that's it. I'm like, we're training that muscle. So I find that like it allows kids to get a bit more in tune with their body in the gym. And I find, again, that's going to be helpful when they're growing and their segments are getting longer, and, their center of mass is changing. I'll give them a bit more of an edge to get over that obstacle quicker.
Absolutely. And so kind of related, but maybe a little bit more of a medical question, Dr. Geminiani. Someone had a question about talking about the iliopsoas area and its effect on the anterior pelvic tilt and hyperlordosis. And so they said that their team has been looking for literature on what's been called lower cross syndrome, where, sometimes can shut down the glutes, that anterior pelvic tilt. And so it says, would you consider this tight iliopsoas a risk factor for lower cross syndrome? If you have any literature on this specifically in figure skaters, can you share that?
Yeah, absolutely. Yes, I would consider the tight iliopsoas a risk for lower cross syndrome, or this hyperlordosis is kind of how I think of it. But I hadn't heard that term before, but I looked it up on my phone, and it is basically that hyperlordosis. There's not a lot of, there's more literature in dancers about it. And with the movement pattern being fairly similar, you could look at the dance literature, or if you get on like PubMed and just, Google or search the lower cross syndrome or hyperlordosis. There's a lot of papers on that. But it's really about, as I said in the slide presentation, would be to gain the flexibility. And there was another, how do you fix an exaggerated lumbar? That's usually from that iliopsoas being so tight. And what happens is the iliopsoas is a big muscle. It's capable of a lot. And the other muscles around there are just very willing to let it do all the work. And so you have to very purposefully think and decide that you're going to have the other muscles participate. And I think that's one of the risks. I mean, Mirai talked about doing, constant repetition. Your body will compensate, as I said, to get the job done, but that doesn't always mean it's using the right muscles. And then you get away with it until you don't. And that's where the problem arises. So I think, as an ongoing thing, the flexibility of that iliopsoas, the flexibility of the hamstrings, because if your hamstrings are tight, you can't get a flexible hip flexor.
Right.
The dance therapists are always on that. So it's got to be balanced. And if you're tight in the hip flexors, you can't even engage those lower pelvic abdominal muscles. They're locked out. They can't participate, and they're perfectly willing not to.
Yeah.
Then the other thing that takes over, because you're tilted forward with the pelvis, then those nice, big, strong back muscles decide to help. And then you get that real significant arch, and then those muscles get tight and stiff. And God forbid, if it goes too far, you get the stress fracture. So these are all excellent questions, and really at the root of what we see so many of the overuse issues. So if you can get a trainer or a physical therapist to come and teach your skaters, how to do these stretches correctly, because I find a lot of times it's, the older kids trying to teach the younger kids, and no offense to the older kids, but that this is not your job. You're not trained to do that. Somebody needs to be very deliberately, focusing on proper technique of stretching. Makes a huge difference.
And just to add to that and bring Mike's explanation that he told earlier about what each joint is, stability or mobility.
Mm-hmm.
When we talk about the tight hip flexors like that, that actually turns your hip, which is supposed to be a mobile joint, it turns into more of a stable joint that's not doing a lot of the moving. Well, if there's less motion in the hip, it's going to look somewhere else to get it, and it's going to be at that lumbar spine. And so the lumbar spine is supposed to be a stability joint area, right? And so now, because the hips are so tight, that lumbar spine now has to compensate, and it becomes more mobile than stable. And that's when we end up with things like stress fractures. And that's why they're so common in figure skating and gymnastics and dance and things like that. So yeah.
Agreed.
Yeah.
Mirai, I'm curious, you being the queen of the Bielman, have you found over the course of your career that you've changed the way you achieve that position? Do you feel like there's a difference in how you use your body strength, that kind of thing? And was that an evolutionary process, I guess?
I think that it's much more difficult now than when I was a lot younger, obviously, but I've been very fortunate in that I think I have a very strong back. knock on wood, but I think I've been injured everywhere else but my back. And so I've never had issues retaining to back injuries. Of course, like Mike talked about, I did have like that one, well, I obviously had a lot of hip injuries, and when the hip was impacted, then I started to feel pain in my knee, and then it would travel up. So it's all very interconnected. However, with my Bielman, I never had that injury. It does take time, and I notice right away if I slack off on my flexibility, it gets very, very difficult, and I have to, work at it slowly over time again. And at the same time, flexibility is so useful in helping me with getting the right positions, and I feel so much better when I stretch every day as opposed to once a blue moon.
Yeah. Well, because you're impacting
Amen
the ability,
to that.
you're impacting the ability for those joints to move. And a happy joint is a joint that moves without having too much duress on it. And when the muscles are tight, it's increasing that duress, and that changes the way that your body, it compensates to make it effective somewhere else.
Absolutely. And so let's talk a little bit about maybe how we find those things. And this is where Ariel and Mike, you can jump in terms of a specific service that the McKinley Center offers. There's a question here. What kinds of analysis or exercises help skaters maintain beneficial alignment, especially when going through their major changes like puberty and growth? And so Mike actually helped develop and Ariel helped develop a figure skating screen essentially. And so why don't you guys talk a little bit about that?
So we've utilized some of the components of the functional movement screen, both the FMS and the Y balance test, to look at the ability for the joints to move properly and assess them. It's a well-studied evaluation tool that it gives us the insight to look at where's the stability, where's the instability, is there a drastic limitation on one side versus the other side, and then based on that, how is that going to impact their performance? We also have a vertical jump. We have a lot of explosive tests because that is the nature of this sport. It's explosives. We want to be able to evaluate the athletes with their capacity to explode, primarily using that triple extension with broad jumps and single leg jumps and vertical jumps. And then we also look at strength. I mean, how strong? You got to be strong. You want to jump, you want to move up to that next level. Well, your strength has to move up with you. You can't move up to that next level without having the strength to support it, or it's going to knock you backwards.
Well, one point I do want to add to that too, I find that people tend to forget that you cannot be more powerful without strength. Like no one, that's not my opinion. That's just basic physiology. You cannot, it's a fact. You can't jump higher without being stronger first. So I find that yes, that assessment, that evaluation that Mike, myself, and Farron and everyone from the McKinley Center kind of came up with definitely helps us as trainers kind of see things from a different lens, especially when we want to get these skaters on a program. So say for the FMS, for testing them on an overhead squat, I'm not looking at how they're squatting. I'm looking at what happens to their knee when their hip flexes, or what happens to their ankle when their knee flexes, and vice versa. And I find with figure skaters, that joint by joint approach that Mike spoke about is really important when it comes to being a figure skating coach and a personal trainer when you're dealing with a figure skater, because from the get-go, that skater is lacking dorsiflexion or flexion and plantar flexion of the ankle because their foot is confined to a boot. So from the get-go, our skaters are already limited in that sense, and it's going to be, that's going to be something that can, definitely trickle down if we don't train these skaters properly, if they don't get, usage enough of their feet, if they don't stretch so many skaters, I take the time to really go over ankle dorsiflexion and plantar flexion exercises. And it's so scary to see how much these skaters are lacking dorsiflexion in their ankles. And then they wonder why their knees hurt, or why their hips hurt, or why their back hurts. And it's like trying to explain to them that, your body has to get that movement done somehow. And they're going to figure out a way, whether it is to make one joint that's not meant to be mobile, they're going to make it mobile to get the job done. So it's our jobs as trainers, to make sure that, training, like you said, Arthur, like you had mentioned the question, how we can help these skaters find that alignment. I mean, just through personal training and through health and fitness training, every exercise we give them, whether it's a split squat, a squat, a tall kneeling press, we're doing a lot of exercises in a functional way that teaches these people teaches the skaters how to control their pelvis, how to control every segment of their body while doing a movement. So I find, the answer to that question is essentially kind of like what strength training is in globes, right? So having that skater do training, you'll notice it's a domino effect of good things. So it'll just kind of help every little aspect one at a time.
Yeah, to quote my colleague, Dennis, who's another sports injury prevention specialist at the McKinley Center, he always says okay, all athletes, want to move like athletes, but you have to move like a human first. And so
God, yes.
if we can get you to move like a human, then we can develop you into the athlete that you want to be. And I love that he says that all the time, especially to our young athletes. And it's like, oh, you can't squat down properly or do a lunge properly. That's probably why you can't really land your jumps. And so, it's a lot of different things. But Mirai, I have a question for you here. It says, from your training experience, what exercises off the ice do you feel gives you the most carryover for you in terms of usefulness? And what training do you do? Sorry, I can't read. What training do you feel gave you the most bang for your buck? Like some examples of exercises and things that you kind of go to.
Yeah, I think I've definitely seen my share of trainers, and I think that I really preferred to be on the ice rather than in the gym. And so I had a lot of trainers who really wanted to work on weight training with me, and it wasn't until the trainer really focused on exercises that I could see why they helped me with skating, that I could really commit to working with weights in general, because muscle does tend to get heavy. And so ultimately, when you're jumping, you really want to look for leaner muscles. And so I would prefer to work with band exercises as well as just balance and proprioception, but and plyometrics. All that stuff makes so much sense to me. But I did have to build a lot of glute muscles to gain the jump height for the triple axel, and so that I did a lot of weight training with. But I think that when you can see how the exercises translate from off the ice to on the ice, the skaters are more willing to do them. And I think that's something that we all go through. And skating is a really expensive sport. And so I think that finding the right trainer is really key to our successes. And I think, I did it all. I also really love Pilates and ballet classes as well. We definitely don't have enough time in the day for all of it.
It's so true. It's so true.
That's such a good point that she's making, though, that, again, it's like you want to fill all your buckets. Like, I know, obviously, we're big advocates for strength training, and I do feel like strength training is really important, but it's also important to do other things that, like she said, Pilates, ballet, other things that help complement her, full circle fitness level and, health. So I find that that's a really good point to make, that making sure these skaters aren't just doing strength training, like go, 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 or doing just HIIT workouts. Like, don't always just do your favorite thing. You want to make sure you're doing different things that help you become a better skater, like a well-rounded skater, as opposed to always like the next fad or like the fun thing to do. Like, unfortunately, there's some things that we may like more than others, but they, help in a whole. So I find that's a good point to make.
Yeah. And so, and thank you for all these answers. And so I want to, we could probably talk about this for hours, but I'm gonna kind of close it out. I'm so sorry if we haven't gotten to your question. Stay tuned. I'll give you my email. You can reach out to me personally and I will get an answer to your question. But I kind of wanted to close out because it's hard to ignore the fact that we're in a pandemic, and sometimes we don't even know if the rinks are going to be open from week to week. And so, there's concern about, are we going to see an increase in injuries because we're spending more time in front of a screen, sitting down, not doing athletic activity? But also, is there any advice that you guys can give figure skaters during this COVID pandemic?
I would say this, as challenging and horrible as this pandemic has been, I think the one silver lining or opportunity with this pandemic is that since so much is not happening, that you can then focus on preparing yourself better to be a skater. I think that's important because you can't train as much as you normally would, perhaps. So you have to be more thoughtful about, slow progression. And very often, I think we rush things. Kids get on the ice and they've been off for 3 months, and day 3, they're jumping. Well, this is too fast. Your body's not ready. And one of the gifts that athletes have, and Mirai can attest to this, is that you know your body. You know what it needs. You know what you have to do with it, or you at least have a sense that what you're doing isn't right, or you need to do something differently. Listen to that voice inside and pay attention to it. And I think take advantage of this time that we've been given to focus on, building things up, becoming a better athlete, becoming a better skating athlete, and going after quality instead of quantity, which I think is always going to help you in terms of avoiding overuse injuries.
Create that foundation. This is the perfect opportunity to create that foundation that you can build yourself on. As Dennis alluded to, you got to move like a human before you can move like an athlete. So let's create that movement pattern, that paradigm that's going to be successful for you off the ice. It will reflect your improvements on the ice will be reflective of the effort that you put forth at this point in time to move you forward.
Yeah. And I mean, again, like using this time, like you said, to take the time to, train and do things off the ice, especially since we don't know if we do have time on the ice. I mean, I've had skaters that I worked with through the pandemic doing off ice training. And when they got back on the ice, they were so amazed by how much they were able to do just by strength training and doing that stuff. And it kind of goes to show, it's like, it's not too hard to maintain strength as long as you are training it. So I find that it made people kind of realize, maybe I was overworking myself. I wasn't training smart. I was training hard. And I find there's a big difference between someone training super hard and working really hard and someone working smart. Mm-hmm. So I think this is also giving people the time to realize what's a more efficient way to take on tasks as opposed to just trying to do something as quick as possible.
And one thing that you can do is you can focus on yourself right now. Just because the person next to you is doing X, Y, and Z, that doesn't mean that you should be doing X, Y, and Z. You need to be doing what's going to be appropriate for you. You need to have having an analysis that gives you that perspective as to who you are as an athlete versus who they are as an athlete. You're not training for them. At the end of the day, you're training for yourself because of your enjoyment of what you do and your activity level. Not for them to be able to enjoy it. It's for your enjoyment.
I love that point. Mirai, do you have anything to add or any closing thoughts?
I think this team really hit it over the nail, and I think that it's really nice that all of the questions are going to get answered in email format. I think that without the pandemic, we wouldn't be having so many Zoom meetings and these opportunities to connect with such qualified members. And so I hope that all of the attendees do reach out and ask questions. Like if they have, I have really flat feet. And so if you have questions about how to build support so that you're not breaking down your skate so much, I think this is a great team to ask, especially since, they're willing to help. They have a little bit more time since they don't have to go into the office as much as usual. And I think that, if these people are telling you that you need to work on your balance or you need to balance out your muscles, you should definitely do it, because I didn't as a young kid. I didn't always listen, and I was very set in my ways, but I learned very old when I was older that these guys go to school for a reason, and they have a vast amount of knowledge that as young as skaters don't have. And so sometimes your elders do no best.
Touchdown, point made.
Well, I just want to take a moment to thank you, Mirai, for joining us. Like, what an
Thanks,
absolute
Mirai.
pleasure to have you here.
Yes, thank you.
And thank you,
Thank you.
Ariel and Mike and Dr. Geminiani. I just enjoy talking with you guys so much. You guys are just bringing brilliant information to the table, but you're also just terrific human beings. And so I
Thank
just
you, Sarah.
also, I know we didn't get to everybody's questions. I know there's more. I'm so sorry, but we have to go to
Yeah,
bed.
we will answer them. I promise you. If
we
you
will,
have others that you
absolutely.
think of, send them along. We'll
Yes,
answer
I'm
those
actually-
too.
I'm putting my
Yeah.
email right now in the chat. Okay, so that's my direct email. Email me directly if you have questions, and I will direct them to the person that might be able to best answer your question if I can't, obviously. But if it's directed to one of the specific panelists, let me know and I will forward that question to them. Okay. So yeah, I think that's all we got, guys.
Hey,
All right.
Yay! Thanks
Thank
for
you
joining.
so much.
Thank you for joining.
Awesome.
thank you for
Bye,
joining,
Mirai.
Organizing,
everyone.
Sarah.
All
Thank
right.
you.
Bye,
Yeah.
everybody. Have a good night.
Oh, bye, everybody.
Can't figure this out. Oh, there it is.
Thank you, everybody. Have a great night.